So they've always cared for adults with congenital heart disease here at Cardinal Glennon. They started as pediatric patients and then they grew into adults, and so just by necessity, our providers would care for them. Adults with congenital heart disease is an ever-growing field. There are actually now 1.4 million adults with congenital heart disease in the US, which surpasses the pediatric patients with congenital heart disease. So there's a really, this is a huge growing population, and there's a need for specialized care for them. Our program started and then we received accreditation. So our program here at Cardinal Glennon is made up of 2 board certified adult congenital heart doctors. They are cardiologists who are board certified in both pediatric cardiology as well as adult cardiology. We also have myself, who is the APP, or the advanced practice provider for the program. And then we have a dedicated nurse coordinator as well. So our team works together to provide care for these patients.
Traditionally, there was no real transition process. A large portion of patients were seen by still pediatric cardiologists, and others were transition adult cardiologists who don't really have the expertise in taking care of congenital heart disease. Concerted efforts have been made over the years to develop a transition process where children are not just handed over to adult provider, but have a process in which they learn about their disease process, become empowered to take over their care, and then transition to a provider who is trained and has expertise in taking care of congenital heart disease. Transition is actually a very large part of adult congenital heart disease, and that's what allows us to kind of have some seamless transition of care from that pediatric environment to the adult environment.
It used to be a lot of these kids could not survive, but that has changed significantly over the past, I would say, 40, 50 years, especially in the past 2 decades. The survival of these patients have been over 95%, so meaning 95% of these patients are gonna grow up and become adults with congenital heart disease, which is the area we focus on in our care.
Rather than having a pediatric environment to take care of these patients where the resources for taking care of other adult comorbidities aren't available, now with this accreditation, we're able to take care of patients as adults and also connect them to other subspecialties that will, again, give a global care model where they're taken care of not just from their heart, but all the other things that may be associated with that. So that was not always the case, but now that we have all these processes in place, it allows us to really do it to the best of our ability.